Namaskar.
Just give me a second. Just give me a second. Hold on. A second. Now you can start. Dr. Kapur, whenever you're ready.
Namaskar. Good morning. Jai Mata Di, Jai Sri Krishna. Lovely morning again. It's not raining. There was too much rain last night even. We need water. So we should welcome the rain because we need water. Everything was dried up. आइए सीधा बैठिए. Next stage, spine straight, shoulder behind. मन सहज, आंखें बंद. ध्यान मुद्रा में बैठ के लंबा गहरा सांस लेंगे नाक से और मुंह से 3 बार बोलेंगे ओम का उच्चारण. ओम भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो नाम प्रचोदयात्. ओम सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःख भाग् भवेत्. ओम शांति शांति शांति. Let's all pray to Almighty for the wellness of whole universe. Everybody should be healthy, wealthy, enjoy prosperity. Nobody should suffer from any ailment, whether that is physical, mental, spiritual, social, emotional, or financial. With these good thoughts, we will start our session. Now keep in mind all the precautions. Follow your body. If you are suffering from hypertension, heart problems, severe acidity, severe asthma, severe backache, or you are recovering from any ailment, please, very gentle to your body. You have to look after the body. This body is our first guru. Only we can do the things, whatever you want to do from this body. So, always look after your body. Do as much your body allows you. When you are doing your practice, just think about yourself. Me and my body, my breath, nothing else. How many people are sitting on the Zoom or in the class does not matter. Does not matter. And we are not doing any competition with anyone. I am doing competition with my own body. Today's topic is a very strong, very, very important topic. You can all see. Yes, yes, you can see. Lovely heart. Heart. And this is a very vast subject. I will try to give you introduction first, and then we will carry on what we can do, how we can prevent, what are the techniques. So simple, we are doing every day. We don't have to do all those strenuous exercises, not for this age. No, it's a lovely golden age, and we are all enjoying. See, you can see the heart. Yes, everybody, you can see the heart. This is the heart. इसकी जो धड़कन है वो सबसे इम्पोर्टेंट है. दिल की धड़कन, दिल की धड़कन, दिल की धड़कन, दिल की धड़कन रुक जाए तेरा नाम, ओ मेरे शाम। दिल की धड़कन, दिल की धड़कन रुक जाए तेरा नाम, ओ मेरी माँ। ये धड़कन है, सारी प्रॉब्लम इस धड़कन की है। Now we all know, हम सबको पता है कि ज्यादा लोग मरते हैं किसी भी उम्र में, whether they are very young, adult or old, of heart attack, and it can be very sudden, जिसे हम कहते हैं cardiac arrest, cardiac arrest. Heart failure तो चलता ही जाता है slowly, 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 because of so many reasons why we develop this heart failure, which I'm going to touch. But suddenly people sleeping in the bed, they're gone. Even the person lying down next to them doesn't know that he has gone already. And this usually happens at the early hours of the morning. That is known as cardiac arrest. Suddenly somebody, beat is gone and they are gone completely. So this heart is very, very important. The causes of heart problem, why it is happening. Obesity, overweight, we all know that. That's what doctor advised, lose weight. Hypertension, diabetes, insomnia, people who can't sleep, they are suffering from all the chronic ailments, including your heart problem. High cholesterol level in the body, which we have covered last week. Yes, or a few weeks ago, I think we have covered high cholesterol. And then poor diet, you are taking unhealthy diet. Then stress, which is at the top of the list, stress, sudden, even the good news we will get, अच्छी खबर आती है तो कई लोग मर जाते हैं सुनते ही, और जब दुख की खबर आती है तो फिर भी मर जाते हैं। तो क्या होता है, सडनली कार्डियक अरेस्ट हो जाता है। And when we don't do any physical exercise, and if you are smoking too many cigarettes, or you're drinking too much alcohol, or even if you are taking too much caffeine, too much tea and coffee, this is well known because this causes the heart problem. So we have to watch out what we are doing. And we will be all coming to the prevention of these conditions. Other thing I would like to tell you, you know how many types is the heart disease? I was surprised to read there are 60 types of heart diseases. 60 प्रकार के हार्ट की प्रॉब्लम्स हैं। सबसे जो कॉमन है, जो हमें ज्यादा पता है, दैट इज अ कॉर्नरी आर्टरी डिजीज। ये पता है ना, कॉर्नरी वेसल जब क्लॉट हो जाते हैं, इनके अंदर क्लॉट आ जाता है, तो सडनली हमारे जो मसल हैं हार्ट के, उनको सप्लाई नहीं मिलती ऑक्सीजन की, तो वो डेड होने शुरू हो जाते हैं। आप सबको पता है, सडनली कहते हैं कि वो उसको जी सडनली हार्ट अटैक हो गया, और उसके सिम्टम्स तो होते ही हैं। और उसके बाद कई हार्ट की ऐसी डिजीजेज हैं जिसमें हमारा जो हार्ट है उसके मसल बहुत ज्यादा ग्रो कर जाते हैं, उसे कहते हैं हम कार्डियोमायोपैथी। तो जो मसल हैं वो बहुत ज्यादा थिक हो गए हैं, इसलिए वो पुअर हार्ट कांट पंप आउट द ब्लड टू द रेस्ट ऑफ द बॉडी। Then very common, which is not seen much nowadays because of the prevention, rheumatic heart disease. ये यूजुअली बच्चों में ज्यादा होता है, यंग एज में, उससे भी हमारा जो हार्ट इफेक्ट कर जाता है। फिर आपको पता है एंजाइना पेक्टोरिस, एंजाइना होता है लोगों को जब कोई थोड़ी एक्सरसाइज करते हैं या खाने के बाद उनके दिल की धड़कन बढ़ जाती है, and they might be getting chest pain even, or maybe sweating, or maybe pain on the left shoulder, left arm, left side. But again आजकल इसको ज्यादा नहीं देखा जाता, कहीं भी हो सकती है, आपके गम्स के नीचे भी पेन हो सकती है, इवन राइट साइड पे हो सकती है, आपकी बैक पे हो सकती है। और उसके बाद हम जाएंगे कंजेस्टिव हार्ट फेलियर। जब ये आपकी प्रॉब्लम चलती जाती है लॉन्ग टाइम, तो पुअर हार्ट कांट वर्क एट ऑल, तो उसे हम क्या कहते हैं, कंजेस्टिव हार्ट फेलियर। और कई लोग ऐसे हैं जो कंजेनिटल हैं, जिनके ना जन्म से ही उनको प्रॉब्लम है। जैसे उनको, उनके जो वेल्व हैं हमारे हार्ट के बीच में 4 चैम्बर हैं, ऊपर का चैम्बर 2 हैं, नीचे के 2 हैं, उनके बीच में एक वेल्व्स होते हैं जिससे ब्लड ऊपर नीचे जाता है। वो उनके होते ही नहीं, या डिफेक्ट होता है, या कईयों में एक सेप्टम होता है हार्ट के बीच में, उसमें डिफेक्ट होता है, होल होता है। दीज आर कंजेनिटल। देन कई दफा हमारा जो हार्ट मसल है वहां इन्फेक्शन हो जाती है, उसके वजह से भी हमारा हार्ट काम नहीं करता। आप सब जानते हो कि जब होता है हार्ट अटैक, तो उसे हम यूजुअली कहते हैं मायोकार्डियल इन्फार्क्ट, कि वो जो ब्लड है, हमारी कॉर्नरी वेसल जो हमारे हार्ट को ब्लड देती हैं, वो ब्लॉक हो जाती हैं। अब ब्लॉक क्यों होती हैं? उनके यही कारण है जो मैंने पहले बताए आपको, जैसे हाई कोलेस्ट्रॉल लेवल, और यू आर डायबिटिक, यू आर हाइपरटेंसिव। हाइपरटेंसिव में ये होता है कि जो हमारी वेसल्स हैं वो बड़ी स्टिफ हो जाती हैं और उसके थ्रू ब्लड नहीं जा सकता। ब्लॉकेज, पाइप में ब्लॉकेज है तो क्या होगा? बस्ट करेगी। ये हमारा रोज का एक्सपीरियंस है। हमारी विंटर के अंदर कैसे पाइप हमारी फटती हैं, फट जाती है ना पाइप, इसी तरह हमारी हार्ट की पाइप फट रही हैं, तो हमारा हार्ट की प्रॉब्लम हमें हो जाती है। इन सब चीजों को हमने अब अवॉइड करना है। अच्छा, और जो बहुत कॉमन चीज है इस उम्र की, गोल्डन एज, एरिथमिया, हार्ट बीट कई लोगों की बहुत स्लो हो रही है, उसे हम कहते हैं ब्रेडिकार्डिया। कई लोगों की ऊपर जा रही है, उसे कहते हैं हम टैकीकार्डिया। ये हो रहा है हम लोगों में ज्यादा, बहुत लोगों में हो रहा है। खासकर जो ऊपर चैम्बर है हमारे हार्ट के, 4 चैम्बर है, ऊपर 2 नीचे 2। ऊपर वाले को हम कहते हैं एट्रियम, एट्रियम नीचे वाले कहते हैं वेंट्रिकुलर। उसकी जो प्रॉब्लम होती है वो ऐसे फ्लटर करता है, अगर ज्यादा वो फ्लटर ही करता है, उसमें कम नहीं करता। इसको हम कहते हैं एट्रियल फिब्रिलाइजेशन। दिस इज वेरी कॉमन इन अवर एज। अगर मैं आप सबसे पूछूं, आप में से कईयों को ये प्रॉब्लम है, एट्रियल फिब्रिलेशन। इसके भी वही कारण है कि हमारा हार्ट काम नहीं कर रहा, क्योंकि जो हमारा हार्ट है ये इलेक्ट्रिसिटी है, सॉर्ट ऑफ इलेक्ट्रिक, इसमें करंट चलते हैं, और वो करंट जब नहीं प्रॉपर जा रहा है तो क्या होता है? फिर इलेक्ट्रिसिटी करंट लगे तो क्या होता है? शॉक। इसी तरह हार्ट को शॉक हो जाता है और हार्ट काम नहीं करता। तो इसलिए प्लीज प्लीज बी वेरी केयरफुल। अगर आपको ऐसे सिम्टम्स हैं तो अपने डॉक्टर को कंसल्ट कीजिए, इग्नोर ना करिए। बार बार ऐसे लगता है डिजीनेस हो रही है, इन कंडीशन में ऐसे ही होता है, डिजीनेस होती है, वर्टाइगो होता है, और लाइट हेडेडनेस होती है। मैं बात कर रही हूँ, आप समझ ही नहीं रहे, क्योंकि कंसंट्रेशन नहीं है, ब्रेन को मिल ही नहीं रहा ऑक्सीजन, तो पता ही नहीं दूसरा क्या बोल रहा है। नो, लैक ऑफ कंसंट्रेशन। और दूसरा, कई दफा अगर सीरियस हो जाए तो आपको बड़ी टायर्डनेस भी होती है। इससे पहला सिम्टम ये होता है टायर्डनेस, always feeling very tired, don't want to do anything, and you can even from the face you can guess that something is going wrong with this person. So these symptoms very important. अगर ज्यादा सीरियस हो जाए तो आप एकदम अनकॉन्शियस भी हो सकते हो, और बहुत ज्यादा हो गया तो फिर जय माता दी, खत्म, लास्ट फास्ट बन जाएगा। इसलिए इन सब चीजों का ध्यान रखिए। और जो हमारी फिजिकल प्रॉब्लम्स हैं हमारे ऑर्गन्स की, ये थायराइड ग्लैंड जो है, ये जब ओवर एक्टिव काम करती है उसे कहते हैं हाइपर थायराइडिज्म। जब वो काम करती है तो हमारा ये फ्लटर होना शुरू हो जाता है, और ये इफेक्ट करता है नॉट ओनली द अपर चैम्बर्स, द लोअर चैम्बर्स आल्सो अवर हार्ट। उसे हम कहते हैं वेंट्रिकुलर फिब्रिलाइजेशन, ऊपर वाला एट्रियल। ये 2 हैं टर्म्स, दोनों बड़े सीरियस हैं। प्लीज डोंट इग्नोर। इन सब से अपने आप को बचाइए, इग्नोर नहीं करिए, अगर आपको वो सिम्टम्स हो रहे हैं, मैंने इसीलिए कहा है, any chest pain, any symptoms like hyperacidity. Sometimes doctors get confused what is this, heart or intestine problem or stomach problem. But they do so many investigation to reach to a diagnosis. अगर आपको palpitation होती है, like you know butterflies in your chest, और light headedness है, घबराहट हो रही है, बड़ी वीकनेस हो रही है, तब प्लीज प्लीज कंसल्ट योर डॉक्टर. डोंट इग्नोर. हम लोग नहीं केयर कर रहे अपनी, हमें केयर करनी है अपनी. वी लीव इट टू लेट. और ये सब कई कंडीशन इंप्रूव हो सकती हैं. कैसे इंप्रूव होंगी? बाय प्रिवेंशन. अब प्रिवेंशन क्या है हमारा? जैसे हमने मेंशन किए ऑल द कॉजेस, तो इन चीजों को हमने देखना है अब कैसे हम अपने आप को बैलेंस करें. बड़ा सिंपल है. अपनी लाइफस्टाइल चेंजेस करिए. लाइफस्टाइल चेंजेस करिए. क्या खा रहे हो, किस समय खा रहे हो, कितना खा रहे हो, और क्या चीजें खा रहे हो. So eat, balance your diet. Look at your diet, what you are eating. Cut down on sugar, salt, and processed food. Eat plenty of vegetables and fruit, and try to have rainbow color, multicolored fruit and vegetable. Lots of mixed grains. दालें खाइए. जितनी दालें हमारी हैं उनमें काफी प्रोटीन है और उसमें हमें ज्यादा एनर्जी मिलती है. थोड़ा सा खाते हैं एनर्जी ज्यादा आती है. और ऐसी चीजें खाओ जिसमें ज्यादा फैट नहीं है. अपना जो खाना बनाते हो उसमें थोड़ा डालिए. आप घी लेते हो तो घी ले लो 1 चम्मच सिर्फ, सारी फैमिली के लिए. अगर घी नहीं लेते आप, जैसे कई लोगों का अभी भी वहम है कि घी लेने से वजन बढ़ता है, पर स्वामी जी के अकॉर्डिंगली, प्रणाम टू स्वामी जी, उनके अकॉर्डिंगली वो कहते हैं 1 चम्मच घी लो, तेल वेल बंद कर दो. अगर तेल लेना है तो बेस्ट तेल है आपका सेसमी सीड, तिल का तेल. तेल का नाम ही तिल के तेल से आया था. हम कहते हैं तेल का नाम ही आया था तिल के तेल से. तिल का तेल ले लीजिए, सनफ्लावर ले सकते हो, और पीनट्स ले सकते हो. उसका कोकोनट तेल के बारे में बड़ी आजकल चल रही हैं अच्छी खबरें और बुरी खबरें. नेवर माइंड, हम इतना खाते ही नहीं है, इसलिए कोई वरी करने की जरूरत नहीं. थोड़ा सा तो खाते हैं हम तेल. रिफाइंड ऑयल वैसे कहते हैं ज्यादा नहीं लेने आपने. एंड ट्राई टू चेंज द ऑयल every week, you know. Don't follow one like mustard. No. खासकर जिनको पित्त रोग है उनको तो मस्टर्ड का लेना ही नहीं चाहिए. तो ये ध्यान रखना है. And other thing which is under our control, do physical exercise regular every day at least. They say 150 minutes moderate exercise per week. पर मैं कहूंगी every day करिए आप. Every day go for a walk. Run if you can run. Watch your knees and your hip. We are suffering from arthritis. Make sure your balance is good if you're going out. And always go with someone. At this age, don't go alone. And other thing is, the stress is the most commonest cause. So get rid of this stress. Do a lot of relaxation, stress management. And when we are coming back to our yoga practice, which is, and the laughter yoga, they are the stress busters. Quit smoking if you are smoking. Even they are seeing after even cardiac problem, you had myocardial infarction, heart attack. If you stop smoking, your recovery is much faster. Then watch how much alcohol we are drinking. We don't drink, so we have to bother. Which is for the class, you know. You may be giving these messages to your friends who are drinking and smoking. Maintain a healthy weight. That can only come with what you are eating. Balance your diet. Because this obesity, overweight is the most commonest cause in young people dying of heart attack. They are obese. That's why they are dying. Even at the age of 25, they are having heart attack. Now we are seeing that, and over there we are saying it is their weight. Going. And manage all your health problems, as I mentioned. What are those problems? Control your blood pressure. Uncontrolled blood pressure is giving us heart attack. Then manage your diabetes. Control your diabetes. And high cholesterol also you have to control. That is very important. For that, we have to watch everything, how much fat you are taking, what type of fat you are taking. Don't take saturated fat. Take your unsaturated mono and poly unsaturated fat. Drink a lot of those things, like you can have some orange, or that you can have lots of nuts, any nuts, almond, walnut, pistachio, peanuts. Have that. They say do your snack. दोपहर में आपको भूख लगती है, instead of having samosa and gulab jamun and this and that, have handful of nuts that give you all unsaturated fat and give you more energy because of the protein. You can take flax seed, which is very good, till sesame seed. You can have that to control your cholesterol. Drink water, lot of water. We are not drinking water, that's why we are suffering. And you know what happens else? If any person have heart attack, mentally, emotionally, they are much disturbed. Because they always think, I may die, have another attack. They feel very lonely. And they're always scared. I have one of my friends, she calls me quite frequently. That's what she's having. She had one blocked artery and they put a stunt, and still she's very worried that she might die. She might have another one. The best thing is, always, please, no talking in between, because this is a big subject, very important subject. Please mute yourself, please. Thank you. Because, and these people, they are mentally disturbed. So best thing for them is they should talk to someone. They can ask a health professional, or they can talk to their family and the friends, and to the spiritual leaders. They help a lot. The spiritual leaders help us quite a lot on this subject. And these happen with any disease, I think. I have seen some of my friends, they were diagnosed with diabetes and they were feeling so low. And now they're different because we are talking and we are managing our diet. So these things are very important. Keep in mind, get rid of your stress, have a good sleep, drink a lot of water, watch what you are eating, cut down your tea and coffee, because that increases your arrhythmia, the beating of the heart. Heart beating goes up. We have seen that. That gives us very, very wrong impression. We feel after drinking tea, I am uplifted. No, you are gone other way around and you are dehydrated even. So that's why you might have seen people who are very clever. They drink water. They get from the, if they are ordering in the restaurant, they get one glass of water and tea or coffee. First they drink water, then they drink tea or coffee. So they are balancing. So these points are very important. Now I am coming to a very big subject, how to get rid of this. There are so many easy steps we are doing every day. Every day we are doing. What we are doing every day? Tapping. Tapping, so easy. Just first clap, go on clapping, go on clapping, go on clapping. You are doing your acupressure. Activation of all the organs. And when you clap, you feel happy. Sign of happiness. Do we ever clap when we are weeping? Do we? Only we, when we laugh, we are happy, we go on clapping. And this is very good for the whole system. Increase the circulation in my brain, my heart, my lungs, my intestine. On my face, I am getting a glow just by clapping. And good for my muscles, my joints. I am more flexible. My bones are getting better. Rejuvenation of the bone. So clap and then start from here. Stress reliever, all worries, anxiety. Oh, I am worried about I might die of heart attack. Oh, I might get arrhythmia. So get rid of all that anxiety, depression. Carry on with a smile on your face. 1, 2, 3, 4, 5, 6. If you can do that. Jai Shri Krishna, 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 Jai Shri Krishna. Under the collarbone, do that. Good for your respiratory system, your heart. Today we are focusing on our heart. Heart. Concentrate on your heart. Dil ki dhadkan. Carry on. Carry on. Then come to the thymus gland. You all know that. Yes? Here. Carry on, thymus gland. You all know the level of the thymus gland. Yeah, that's here. See, this is my sternum, the dimple here. Dimple here. And below that last bone, in between, this is my heart level. So I am doing my thymus gland to get rid of any anxiety. Anxiety of my heart problem today. So press it hard, press it hard, press it hard. Very good. Now here also you can do your stomach, upper part. Why upper part I am doing? And I am concentrating on the organs actually. I am trying to concentrate on the organs. You are concentrating on the organs now. I am having high cholesterol level, so I want to improve my liver. So bash on the liver. Liver is the one who is responsible to manage my lipids level. So I am doing that. And the spleen I am doing for the blood formation. Carry on. Then diabetes giving me heart problem. So do your pancreas, which is here. Do this like this. Pancreas. Tapping on the pancreas. Very good. Carry on. Tapping. Then you can do your kidneys also. The level is from your umbilicus going back. Push that area. Kidneys are damaged also, you know, because of various my problems like hypertension, obesity, and diabetes. Other thing is, you know, people are getting this problem of arrhythmia because of imbalance of electrolytes, like I mentioned, calcium, potassium, magnesium. The kidney is responsible all those for electrolytes. So you go on doing. Very good. Well done. So you have done your tapping. Now come to this area, thyroid gland. because people are getting arrhythmia because of the thyroid gland is very overactive. So we can do like this. We are just attacking the causes. Only we'll get better if we know the cause, and then we can do various yoga practice on those organs. So I am doing my thyroid gland activation. And the parathyroid gland is behind. So do like this. This is the one which control my calcium metabolism. My small glands at the back of thyroid gland known as parathyroid. So heart is involved for any reason. The big pump is involved because of any reason. Any physical, mental problem, we get heart attack. Heart attack. Another simple thing you do every day to get rid of your emotional imbalance by rubbing your fingers. Start with the thumb. Get rid of worry. Worry of my heart attack. I might die. I'm going to bed. पता नहीं सुबह उठना भी है कि नहीं उठना. यही सोचते हैं ना जब सोते हैं. सुबह उठना है कि नहीं उठना. फिर उठ के सुबह उसका शुक्राना करते हैं कि हम जिंदा हैं, आपके दर्शन हो गए. यही कहते हैं ना. सुबह उठ के यही कहते हैं ना, अपने हाथों को देखो जिससे कर्म करना है. महालक्ष्मी मां सरस्वती है गोपाल गोविंद. यही कहते हैं ना. अगर उठेंगे तो कहेंगे ना, अगर मार मुर गए तो वहां जाके कह देंगे उनको जय गोपाल. इसलिए इस वरी को दूर करना है. Rub your thumb with a smile on your face. Then come to index finger. Fear. Fear. I might get heart attack. My friend got it. I might get it. Fear. Get rid of that fear. The next one is your anger. गुस्सा. हाय मेरे को क्यों हुआ रिदमिया. हाय मुझे क्यों हुआ रिदमिया. यही करते हैं ना. हाय मेरे को क्यों डायबिटीज. यही करते हैं. उसके बाद sadness. Once you are diagnosed, we are all feeling very low. Whatever we are diagnosed, we feel very low. So if we do all this rubbing business simple way, we will feel better. And plus, if we talk to our friends, to our family, and discuss with your health professional, try to understand, and they can plan out for you everything, how to manage the condition. They will refer you to the people who can help you further. Like if you have got diet problem, you don't know what to eat, what not to eat, they will refer you to a dietitian. The next one again for the heart. Then come to this point for the immunity, middle of your palm. So simple things we can do to get better, you know. And we are doing every day. The thumb, the index finger, the middle finger, the ring finger, and then the little one, and in the palm. That's why we do all this twisting. Twist your body. Very good. Backward and forward. Whatever you are doing, you are giving exercise to your heart. Wherever the body moves, this will also move. So whatever action you are doing. So next we will do now physical exercises which you are doing every day. Now start while sitting even. Tadasana. Breathe in from the side. Raise your hands up slowly. Now follow your body. You know, even after a heart attack, they start doing exercise pretty fast, not at a fast speed, very, very slow. Put your hand here, raise your arms up. You are doing Tadasana while sitting. And you can raise your feet up, raise your heel up, Tadasana sitting. I am recovering from my heart attack. I am very slow. I am sitting and doing that, all this. Then come down slowly. Now this is very good for your heart, for digestive system. Then again your hands up, feet are on the ground this time, and move your body sideways. Then you come up slowly. After the heart attack, they give you cardiac rehabilitation. Many times we think we should not do any exercise after heart attack. No, we have to do it. We have to do it gently first and then build up your stamina and carry on. Well done. The next one while sitting you can do is your breathing. Stretch. Stretch. Look at the ceiling. Look at the ceiling. Then you come down slowly. Very slowly here. If there's a back problem, don't bend forward. Very important. Otherwise, you can touch your ground. Touch the ground. Look down. This is very good for your heart and brain and for the hair growth. Then you go up slowly. Slowly up. Very good. Stretch again. Then breathe out and go down slowly. No fast movement. I am recovering from my heart problem. I am very gentle to myself. Then you breathe in and go up slowly. Stretch. Then bring your arms down while exhaling. Coming down, breathe out. Going up, breathe in. So easy. Next one, breathe in. Take your arms up again. And you are bending on the left side. You can touch the ground if your body allows you. Stay there for a short time. Then come up slowly. Other side. You can do everything what we are doing as every day. Every poses, every exercise, even Surya Namaskar, jogging, you can do it. But again, at a slow pace. As you are improving, you can increase your pace. If you don't do any exercise, you won't recover even. Next one again, stretch your arms in front, then bring it up. These simple exercises. Your heart is getting all the exercise. The blood circulation increasing in my heart. Heart muscle is getting better. Very good. Very good. Then from the side, do it at a slow pace. Then you can twist your shoulders. Again, how much work is happening on the heart. Go on breathing in and out, Bhamri Pranayama. With heart problem, you're supposed to do all the steps of pranayama. All the steps, though concentrating more on Bhadrika, Alom, Vilom, Ujjayi, then Bhamri, Udgit, and Pranam. These we do more, because they are more helpful for my problem. We are supposed to do Kapalbhati. There was a misnomer that don't do Kapalbhati. No, please do Kapalbhati at a slow speed, less power. Kapalbhati is a must to increase our respiratory system. If the respiratory system is not proper, how the heart will work? How we can purify our bad blood, which has to be oxygenated only with respiration. So we are supposed to do everything. You can do all the poses, but gently. Now again, we do half camel pose also. Put your hand at back like this on your hips. Breathe in and go back. When you breathe out and come back, this is known as half camel pose. Very good for the heart. Breathe in, go back. Look at the ceiling. By doing this, you are increasing the activity of your thyroid and parathyroid gland also. When you're doing this, with the neck movement, then you breathe out and look straight. Other one is known as half moon pose or the Chandrasana. This one. Breathe in and go back. Then breathe out and look straight. Simple while sitting. Carry on. Breathe in, go back slowly. Mind your neck. If there's a neck problem, please don't do it. Very good. Well done. As you are sitting, we will do a few more, like your Gomukhasana. Make sure the knees are in one line. Take this arm straight first, then go back and try to meet the hand. And you can look up. Gomukhasana. It's a very good asana for the shoulder, for the heart, even for the pelvic floor. For the prostate gland, the uterus. Good for my heart. Gomukhasana. Cow's pose. Then release. Now other side. Very good. You can look up. Look straight. So you have done this one, very good. The next one is known as Shashakasana, rabbit pose. Breathe in, breathe out and go down. See here, if you want, we can start our Kapalbhati. But I will say if you're just recovering, I won't ask you to do it. Once you have got your stamina, you are feeling much better, then you can start doing at a very slow speed. Because in the beginning, you have to be careful. If there's no problem, we are doing as a preventive method to look after our heart. You can start doing it Kapalbhati also. Do 10 times. with all the precautions in your mind. Hypertensive heart problem, severe acidity, slow. Any major surgery? No. Any bleeding from anywhere? No. Even after minor surgery, you ask your yoga teacher or your physician which one to do it, how long to do it. Any headaches? No. So you always keep in mind all the precautions. Now I am not suffering from heart problem, but I don't want to get problem. I am doing as a preventive method. Yoga is primary prevention. Then you come up, stretch again, bring the arms from the side. Next thing we all do that. Heart problem is because of my diabetes, my liver problem, my spleen problem. So we do Mundu Carson. Again here you can do Kapalbhati as you are not suffering from heart problem as a prevention. But if you are, then you have to be a little bit slow. Just do the asana, don't do Kapalbhati. Then once you are recovered, you are much better, then yes. Okay. Breathe in and breathe out fully. Then come down very slowly, look at the ground, then look straight. This asana is very good for my diabetes, for my liver, gallbladder, the spleen, and the pancreas, which is in the center. And for the intestines also. Then you come up very slowly. Don't come too fast, very slowly. See? Very slowly. Otherwise you will get giddiness. Or you will get pain in your muscles. This is the one pose, second one is left hand at the navel, right at the top. Breathe in. Breathe out fully. Squeeze your stomach in nicely. And then come down very slowly. No jerks. I love my body. Down first, then straight. Then come up very slowly. Now, if the cholesterol problem is there, I want to target more my liver. Make a fist and put it there. Dig it in, because there's fat on the vein. And press it hard. And at the same time, you can do your spleen also. Do Kapalbhati if you can do it. If you can't go down, doesn't matter, because sometimes there's not much room, you know, if we have got extra fat on our belly. So sit straight and do it. So I can tell you in a nutshell, if we are obese, then we have to do all the poses, all the exercises for weight reduction, which you are doing every day, every day. Get rid of extra weight and get better with your heart. You won't have heart problem. All the exercises we do. The upper arm, the lower arm, then the abdominal organs. Well done, my friends. Okay. Other pose you can do is known as Yog Mudrasana. Left hand at the navel, right at the top. Breathe in and breathe out fully. Come down. Imagine your chin is touching the ground. This can only be done when you're sitting on a mat. And this is done exactly at the lotus position, the Kamalasana. But we are doing the variation. We are looking at the ground. Very good for my heart. And with various other benefits. Stay like this. And you breathe in and come up very slowly. The second pose for this is, which is very, very effective. Sit, I'm just doing demonstration. Hold your hand at the back. Breathe in and breathe out and go down. Yog Mudrasana. Then come up slowly. Now coming to various other asanas while you are lying down. Let's touch some of them. I won't be able to cover everything because, as I said, I have to cover pranayam in more time. Pranayam is the first and the foremost. So I am lying down on my tummy. Get rid of stress. The Makarasana. Lie down and stretch your body. See? Stretch. Arms in front. Legs are touching the ground. Relax yourself. Stretch. Next, first pose. Put your hands underneath your chin. Lift your one leg up. The right one. I am targeting now weight reduction and activation of all the organs, including my heart. So, raise your one leg up. One leg up. I may be moving a little bit fast because I have to cover. Another one at your slow pace. Otherwise, you will get cramp. Try to raise both. If your heart is okay, if you are recovering, don't do with both the legs. This is a precaution. Don't do with both the legs if you are recovering from heart problem. You have to go very slow. So, the next one is your Bhujangasana. Very good for the heart. Chin on the ground. Raise your head up. Very good for the heart. First pose, second pose, hand on each other. Put it, your chin on the hand, or you can take your hand underneath your chest. Then breathe in, raise the head end. Here the arms are open up completely, full Bhujangasana. Very good for the back and for the abdominal organs. For the backache, this is the best poses. For the heart, when you come down very slowly, you have to be kind to your body. Now, the next one, you can do put your arms underneath your thighs, chin on the ground, and raise your right leg up. Hold it, then bring it down. Do the other leg. Hold it, bring it down. Don't do with both the legs up. No. Then put your hand at the waist, raise your head end, and bring your hand down on your hips. Shalabhasana. Camel. Shalab. Hold it. See? Very good for the heart. Then bring it down. Now, if You are feeling okay. You have recovered, or you have no problem. Take your hand at the back again at the waist. I'm going to raise both the sides, the legs and the head. But if I am still recovering, I won't do this. I leave it. Just I am doing with head up. The first one I did. You have to go slow with that. So these are the one. Now the next ones are very easy. Hold yourself like this. Bend your knees. Bend your knees. We are going to be soon. We will be cat and cow. Gau mata banenge bhi. Press it hard. Now take your head down. Head down. That is cat pose. Billi ka asana. Good for my heart, my lungs. Then you look up. Look like this, up. Now there is cow's pose. Go mata. Stay like this. And if you can bend more, come up on your feet, head down. That is downward dog. This is very good for my heart. Very good. Well done. So so many other poses you can do while standing, lying down. Now lie down on your back. And then I said the cause for your heart problem is overweight. So all the exercise we do for the obesity, raising your legs up. 1, 2, 3. We do less time because of the time. Left, up, up, down. Then you do your rotation, 360 degree. We do every day, clockwise, anti-clockwise. Again, raise your leg up, give a good rotation. Sorry, I'm doing a little bit fast because of the time. Well done. Then other one you can do cycling. Want to get rid of extra weight. That is giving me heart problem. Arrhythmia. My heart is like butterfly. Palpitation. Other one. But do with one leg if there is a problem. Go gentle. Do slowly, slowly. Another one you can do for your heart, which is very good. This one, Setubandhasana. Lift your spine up. Setubandhasana is very good for the heart. Bring it down. Another one you can do your Uttanpadasana. Raise your leg just 30 degree up. Very good for the knees, for the heart, for the flexibility also. Down. Other one up, 30 degree. Hold it. Then take it down. Don't do with both the legs if there's heart problem. You can do no Carson. Very good. Very good. You can do Pavan Mukta also. because so much exercise is happening. Go up, backward and forward, sideways. Well done. Just relax now. Go in the Shavasana. That is the one which is going to relax whole my body. Close your eyes. Go on taking some deep breaths in and out. Once my heart rate is normal, respiratory rate is normal, I will be feeling more calm and balanced. Go in Shavasana. You all know how to do it. This is a relaxing pose, which we are supposed to do after any asana or physical exercise we do. Relaxation of all the muscles, all the ligaments, and all the organs, including my heart, my brain, my lungs, my other organs. I'm not going to carry on because time is very short. Just demonstration. Try to relax by doing Shavasana. This is the way we do on the back. Other one we do on our tummy, Makarasana. What we do? Put your hand on each other. Rest your head there. Separate your legs as you have done in Shavasana. And stay there in that position. This is another way we do our relaxation. Now this is very important. Before you start doing pranayam, your body should be in peace, harmony, no tiredness. So that's why we are rested now. I'm going to start with the pranayam. So please get up very slowly. No rush. Take your time. And we will do pranayam, and I will tell you the Ayurvedic treatment for this heart and what you have got in your kitchen. You can get so many things in your kitchen to get better with your heart. Everything is there in our cupboard. Only we have to know how to use it. Very good, well done, my friends. I hope you are enjoying it. It's a vast subject, you know. Never mind. As I already said, for this to get rid of my heart problem of any type, you know, there are so many types, as I mentioned, 60 types, they say, to do pranayam. If you can't do anything else, your body doesn't allow you to do anything else, just do soft, gentle exercises and pranayam. Spend about 80%, 90% of time on pranayam. The whole problem is of this breath, lack of oxygen, which is creating so much problem. Bhadrika we have done, there are 8 steps, as you know, Bhadrika we have done, Kapal Bharti we have touched again. And the next one is your, we usually say if you got heart problem, lungs problem, don't do Bhamri Pranayama, okay? Same goes for the Agni Sakriya, Ujjayi you can do it because we want to activate our thyroid gland, plus it's good for heart and lungs, plus it's good for weight reduction also, Ujjayi Pranayam, because this gland control our metabolism also. So that's why we'll say do Ujjayi Pranayam. So we'll do twice Ujjayi Pranayam. Then I will come back to your Mudra and acupressure also, okay, for the heart. So let's carry on. Ujjayi Pranayam, squeeze your neck muscle. You can first cuff if you want, but we are going on for a long time. You're not talking, I am talking. My throat is clear, but you can cuff. Then squeeze your neck muscle, breathe from the nostril. The sound of snoring like come from your throat from here, from the vocal cords. Go on breathing. as much you can do. And then you hold your breath. You can bring your chin close to the chest, known as Jalandhar Bandh. But if there's a neck problem, don't bring your chin close, just keep it straight. You can't hold anymore. Again, very good precaution. Never hold your breath if you are hypertensive, severe, or heart problem. Please don't hold your breath. Otherwise, there's a trouble. Then you can't hold, then you close your right nostril with the right thumb, exhale from the left. Now, this is a very, very important pranayama. This is going to activate your thyroid gland and weight reduction and taking away your heart problem. So you're supposed to do this many times, not 2 or 3 times. Carry on doing. And with that, you can do one thing more, your acupressure point of your thyroid gland. You're supposed to do this also for a long time, thyroid point. Yes, both the hands. So let's do it just once or twice. Ujjayi Pranayam. Next is your Anlom Vilom, which we are doing most of the time. So carry on. This is we have to do for a long time. Anlom Vilom, we have to do now. I will do about minimum 3 minutes, all of us. This is most important. Sit straight. Well done. The next one is now very, very important. We are doing every day. Every day you are doing for the last maybe more than 1.5 years. The nitric oxide production. We are doing every day. Yes, you are doing in detail. So try to do that. Humming, that is going to increase because the nitric oxide is produced by the body stored in the body in the lining of your blood vessel. The blood vessels are all over the body, including my heart. Blood vessels are there. So if I increase my nitric oxide, I won't be getting heart problem. We are doing every day. We are doing the exercise, 4 or 5 exercises, and do humming. And then we look after the food, what we should take the food which have got more nitrate. The nitrate is the one which is converted to nitric oxide in our body, starting from our saliva. That's why we say don't use mouthwash it, because you're going to kill your healthy bacteria which is required to digest the food. So you all know this. This is done every time, I think every session. I'm not going to go into detail. Only we will be doing humming 3 times. What else is happening? See, there are so many benefits. Just watch your face. You are doing your facial yoga. Getting of this wrinkling, getting glow on your face without putting any cosmetics. We should always look our face before we starting the session, at the end of the session. This yoga is a magic, doing everything. Yes? So many side benefits are coming when we do one step of any action of yoga practice. So this is very important. The next one is again, we have to spend a lot of time on Bhamri Pranayama. In that also there is production of nitric oxide, but not at that level as humming does. And this we should be doing Bhamri many times. This is very good for heart, for hypertension, for menopausal problems, which is such a common problem in the woman, and for sleep. Insomnia is getting better when we are doing Bhamri Pranayama. If you can't sleep, just try to do it when you go to your bed. Just do it, and you will be sleeping. So we are supposed to do more time, but time doesn't allow, so we'll do 3 times only. Bhamri Pranayama. Next, Udgit. This is also very great help, like benefits as I mentioned in the previous one in Bhamri. So do Udgit for long time, not 3 times, do maybe 50 times, carry on your own body and your own time. Go on doing Udgit. And once you are doing that, you will be in a trance. You will get to your aim where you want to reach. Samadhi, the union of soul to the super soul. Just when we are doing loud, loud Om उच्चारण, जब हम जोर से बोलते हैं, हमारे कान सुनते हैं वो आवाज, तो हमें अंदर ही अंदर आनंद आना शुरू हो जाता है. चलिए करिए, 3 बार ही करेंगे अभी. The 8th step known as Pranayam. Prana means Om. Om. The supreme power. So here we are in the silent meditation. Fix your mind either on your breath or any chakra of the body and go on chanting the Lord's name inside quietly. Whatever you do, your prayers, or you don't do any prayers, then you think of the nature, the cosmic power. Prakriti, उसका सोचिए कितनी डिवाइन है, कितनी डिवाइन है हमारी प्रकृति. Go on. This is your silent meditation.
We can go to mall first.
Excuse me, please mute yourself. Give me 5 more minutes, then I will ask you to ask me anything. Mute yourself, please, please. Silent meditation. And always say to yourself, I am never alone. I am never alone. The supreme power is always with me. And we are in the state of gratitude also. उस भगवान का कोटि कोटि बार शुक्रिया. जो भी उनका नाम है, धाम है, उनका कोटि कोटि बार शुक्रिया जिन्होंने हमें इतनी शक्ति प्रदान की आज के योग अभ्यास की. Raise your arms up, rub your palms. Put the palm on your eyes. Slowly you open your eyes and remove the hand. Okay, now I'm coming back again to the assisted pranayams. They are very, very important, you know, also. You all know about Shitli and Shitkari. They are also going to make my heart better. Shitli, you bring your tongue out and go on breathing. Excuse me. Oh, चलिए शीतली करिए आप.
222 months. I 22 months.
The next one is Shitkari.
Sit all the way.
You unmute yourself, Dr. Kapur, again. Don't know what he's done. I can't get the
Shitli,
Ravi Sharma.
Shitkari, you
Ravi
have done.
Sharma ji.
Another one is Chandravedi Pranayam. Chandravedi. The left nostril is connected to the right brain. So we will be doing Chandravedi Pranayam to make our heart better for the hypertension, hyperacidity, and many other problems. For my anger and greed. Okay, Chandravedi. Sit straight, relax your body and the mind. Close your right nostril with the thumb. Breathe in from the left nostril. Now, if you can manage, you can hold your breath, close your left nostril. We are holding. Sometimes with the practice, we don't have to hold even. We can do automatically, holding our breath. But in the beginning, sometimes it's difficult. Breathing in from the left nostril. Holding now. Then close the left nostril, exhale from the right. This is your Chandravedi. Now, how long to breathe depends on your practice. You can do 2.5 seconds, 5 seconds, or maybe longer. Some people can do much more if they are practicing this. So try to practice this more. And this one is going to, you know, increase my parasympathetic system. The people who can't sleep, they should lie down on the left side and do this, and they are sleeping with short time. Okay, very easy. Once again, close your right nostril, breathe from the left nostril, deep, deep, no rush. Go deep, slow. Hold. Then close the left nostril, exhale from the right. So this is what we are supposed to do. Now coming to your mudras.
Do you have to do
Depends.
both sides? Do you have to do both sides? Like, you know, we do it from
No,
the...
my dear, this is known as
No, okay.
Chandravedi.
Yeah.
We are activating the left moon. This is known as moon nadi. This is known as Surya nadi. This gives you more activity. It will raise your blood pressure. So at the moment we want to lower, we want to go into balance. As this is also increasing my parasympathetic system, it's going to lower down my heart rate. I am suffering from palpitation, fluttering of my heart. So I want to make it normal. That's why I'm doing the left nostril. Nose as Chandravedi. Okay, Chandravedi, Pranayam. And when there is an opposite condition, you are very low, your blood pressure is low, your heart is poor thing not working, and you want to be active, then you do this one. So let's today concentrate on this. Today's topic is heart problem. Okay. Next one is your acupressure points. Now, as I mentioned, if you are recovering, please don't do Kapalbhati, but if you are recovering very well, do it very, very gently and carry on. And once you are back to normal, then you can do at your own speed, like moderate speed, you know. But never do fast. In any condition, I say never do fast, especially when you're on the Zoom, especially. Now, what is the mudra? Mudra is this one, Namaste Mudra. Namaskar. This is activating my heart and cooling my mind. एक दूसरे को रिस्पेक्ट देते हैं ना, और प्रणाम किसको कर रहे हैं? जो आपके अंदर बैठा है उसको, सुपर पावर को, वो सबके अंदर है. So this Namaste or Anjali Mudra is the one which is going to help you. And the second mudra you do every day. Every day. Apan Vayu Mudra. Vayu Mudra, Apan Mudra. This is for the heart and for the breathlessness. We do every day. So if you are suffering from those conditions, please try to do this mudra whole day, I will say. Whole day, carry on doing it. To get rid of your heart problem, breathlessness, and this will lower your blood pressure also. Yes? So we sit in that, even when we are watching lovely series going on the television, there are some pravachan going on the television. You are traveling in the car as a passenger, go on doing. My heart is not working. I want to activate my heart. Yes? And do mantra chanting inside, any mantra, any name, any dhun, any bhajan, any shabad, go on doing. The heart will get better. Coming to the acupressure points. We all know heart point, which is here. On the left hand, this line, press this one. Press this one. Go on pressing. These pressure points, when we do, they are diagnostic also. We can know the problem is going to come after a few years or few months. It gives you indication, diagnostic. Diagnosis is being occurred. And then treatment is there. So whole treatment is in our hand. So press this point. If someone is having heart attack, you are there. Try to put this nail, you know, of the little finger in your teeth and do like this. Someone is having heart attack. I'm waiting for the paramedics to come. Do this. This will help them. So these are few points, and there's so many things you can do. Now, there are certain food which we should be eating more not to have our heart problem. One is very good to know, dark chocolates, but don't take too much, maybe small bite. Very good for the heart and for various other things also, for your nitric oxide production also. So some things which we thought are very, very bad, they are not that bad, you know. Then coming to flaxseed, we all know that flaxseed, we should having flaxseed. That is the treatment for various ailments, flaxseed. Dalchini, then garlic, if you can take garlic, onion, then mixed nuts, almond, pistachio, walnuts, peanuts. Have them as snacks, as I mentioned. We take, you know, we want a cup of tea, let's say. Oh, biscuit is a must, isn't it? And we don't know, they're all full of saturated fat and trans fat. So try to avoid if you can. I am also trying. Please, you also try. I have also bad habit. Plus, I had another condition for which I had to take it. I will mention on your next week. That is lined up your topic, you know. Then oatmeal is very good. Soluble fiber for us. Good fiber there, you know. Raisins is very good. Try to eat grapes. Not too much. If you are diabetic or overweight, try some grapes. They are
Green
the
or
raisins,
black?
you know.
Mrs.
Then red
Kapur,
kidney beans, Rajmaha is very good. That lower your cholesterol also and give good fiber to have, not to have constipation. All the pulses are good, which we are all taking, all vegetarian, you know, don't take meat. But if you are taking meat, watch out, don't take too much fat on the meat. Have chicken or fish, special fish, you know. You can read about that. I have no knowledge. Then try to do all mixed color fruit and vegetable, red, yellow, green, even brinjal color, purple. That is very good. Coming back to Ayurveda, which I am not a Veda myself, whatever I hear, I am telling you. Arjun ki chal is very good. You can make kada of that. Then Amrit Rasayan is very good. Dal chini, you
What is
can do
Arjun?
that.
What is Arjun ke chala?
Arjun ki chal is a brick, you know, one tree. Chal means the covering, skin.
I know, but where can you get the Arjun chal?
You can order on the line in Birmingham. Yes, Ashok ji is our local Vedic.
Okay.
He can give you.
Okay.
And maybe you can ask Shaman ji to get his number. These things are available here in this country.
Thank
Then
you.
we can do these things. If we can't do, dal chini we have got in our cupboard, isn't it? Dal chini. That you know, dal chini. Have dal chini water, you know, morning, evening. Put dal chini in when you make tea. I put what in my tea? I put even flaxseed, dal chini, long, yeah, saunf even. Saunf is very good. Then try to have sprouted foods, you know, like you can sprout them like your moong ki dal, chane, black-eyed beans. Then लौकी का जूस, लौकी खाइए, जूस पीजिए, उसका सब्जी बनाइए और उसका हलवा भी बनाइए. Then till is very good. Sesame seed is very good. So if we look after our food, what we are eating, we are getting better. And you can do anything, as I mentioned. Most of the things you do every day, you can do it. Surya Namaskar, jogging, then exercises and asanas. So many asanas are there, but you can't do every asana in one session. Try to pick up the one you like and go on doing that. Increase your immunity. Have a lot of laughter. Another one is your loin pose. Come on, Singhasan. This is very good for your heart,
Dr. Kapur,
And
Dr. Kapur
Anji.
can add something more to it? Can add
yes,
few
you
more?
can add quite a lot. There's so
No,
much,
just
my
few
dear,
lines,
you know,
just
I
few
don't
things.
know.
Add some notes. 10 superfood eligible to reduce fat and for blood pressure. Almond, watermelon, as you said, also beans, a lot of different beans.
Yeah,
dal,
different beans, yes.
celery, cucumber, tomatoes.
Yeah, they're all vegetable, you know.
Yeah.
All
Avocado.
vegetable.
Just some notes. Also, all the spices you mentioned, like ginger, turmeric, mustard seed, cinnamon,
Yeah,
cumin,
mustard seed.
coriander, black pepper, and cayenne pepper. And
Black
also
pepper
try
is
to
good
take
for everything.
half
Now
teaspoon
going
of
back to broccoli also, I
that's the
forgot.
broccoli. Yeah. I'm just
Broccoli
mentioning
and
Loki.
Brussels sprouts, which
Brussels
people
sprout,
don't
yeah.
like in my family.
That's it.
Every
Also,
day they
coconut.
say you should have broccoli, avocado.
The
and-
avocado.
Yes, this is very important. But
Also,
problem is,
coconut
in my
oil.
house, they don't like all this.
Try to
So I
take
have to do for myself.
half teaspoon of coconut oil daily. Virgin coconut oil. That's good for health as well.
Yeah, but avocado, not a full one, because then it's got fat as well.
Half.
So
Usually I eat half every day.
Half.
And also very good for intermittent fasting. That's very good for also, because you're getting older, it's only eat one hot meal a day. That should be diet. That itself will help you to reduce your blood pressure and everything else. No, thank you. I thought I had few notes myself. I thought sat down to it. Thank you. On you go, you take over.
Yes,
Darling.
I think most of things are in our kitchen, you know.
Yeah. All the
Haldi.
spices.
Yeah, all the spices, black pepper.
Black pepper.
People put salt on their fruit when they have fruit chaat. Or they put fruit chaat, the chunky chaat and whatnot.
That's right.
MDH and other shan, they are horrible. They are horrible.
हमने ये सीखा है जो स्वाद के लिए अच्छा है हेल्थ के लिए खराब है जो स्वाद के लिए अच्छा नहीं है हेल्थ के लिए अच्छा है
I think just put black pepper and lemon if your body allows you.
Yeah.
Nothing else you need. Black pepper is the one. For everything, put black pepper.
if everybody stops sugar, their diabetes will go low as well, and they will lose weight as well. So anything white, sugar avoid karo, nimak just have a little bit in the food, not on top.
That's Saroji speaking. Okay, well,
Sorry.
Salt-free diet for many people. Depends for your kidneys, you know.
हम बता रहे हैं कि अभी हम जो
That you
mountain
can't
गए थे
just say like that. That like that you can't say. And if you have got low blood pressure, you need salt, my dear.
Yeah, that's right. But what happened was when I went to the mountain climbing at Monroe at the Snowdonia mountain, I sweated a lot. So once the sweat dried up, I had a white mark on my head. So all the salt got deposited in my head. And that's why once you lack of salt, gives you cramp in your feet. So you have to eat more salt. So I had a salted crisp of peanuts to, to top up my salt. You just need certain amount of sodium as well for electrolytes, for body to work properly.
Salt is a must for the body. Salt is a must.
Can I ask something?
Yes, you're welcome now. First of all, tell me who requested this heart problem topic. Somebody, because many told me they want heart and then they want diverticulitis next week. Who requested this?
Kanchanji.
Hanji?
Kanchan. I can't highlight
Kanchan. Thank you very much, Kanchan. Thank you very much. You asked me because this is the only way to read and increase your knowledge. Because this gray matter is going down every day. Thank you very much. I'm very grateful to you. You asked this topic.
Thank you very much. You explained it so well. And I'm very happy with this video. Thank you.
Stay arthritis.
Thank you.
Now, who is suffering from diverticulitis? They asked for that.
Thank you very much.
What is that?
Again,
What is that?
Kanta Bhen.
What is that?
You suffer from diverticulitis?
I asked.
Yeah, you suffer.
I just started. They just diagnosed it.
I see.
What is?
We will cover
Doctor,
that.
what is this?
Okay? And we can give you a story also if you want. Next week when we start, because then you can tell us also what symptoms you had and how they diagnose. It's not easy to diagnose, my dear. It's not
No.
easy. You suffer a lot, then the diagnosis is established.
Yeah, that's it.
Am I right?
Yeah, that's right.
They diagnose with the symptom, not with the with the testing.
No.
They can't test it.
Yeah,
They
this is
had
the thing.
the colonoscopy, and then that's what
Yeah.
they from there they diagnosed it.
So that's very nice.
Yeah,
I
and,
hope to cover that next week.
and plus, what has happened now? I had high blood pressure.